This is Lorena Mora-Mowry from Latina Today. Vamos a aprender hoy al listo para obtener seguro médico. We're here with Trey Daly. He's Ohio State Director of Enroll. Welcome to Latina Today.
Hi Lorena, it's great to be with you.
We're here in the headquarters of Get Cover America in Cincinnati, and we want to reach out to you, to the Latino, to understand the possibility to have a quality health care and the freedom to choose the one that you fit the most. So let's go and talk about the Latino that live in Ohio. This interview is about us.
So Enroll America is the organization I'm the state director of Ohio for. It's a national organization, nonpartisan, nonprofit. Our goal is to reach as many uninsured people as possible to provide them basic information about the Affordable Care Act and their new options for quality, affordable health coverage through the health insurance marketplace. Our campaign is called Get Covered America, and that reflects our attempt to reach out one by one to as many uninsured people as we can, to give them that basic information, get their contact information so we can follow along with them, have additional conversations with them, make sure they have all of the information and the tools that they need to pick the best health coverage for them and their families.
Let's talk about Ohio. Do you have some numbers that you would like to share?
Sure. There's about 1.3 million uninsured folks in Ohio. Around 5% of them or so are Latino or Hispanic families. It's a smaller percentage than the rest of the country because there's a smaller number of Latinos in Ohio. But across the country, and as well in Ohio, Latinos are disproportionately uninsured for a variety of reasons, oftentimes because their employers don't offer health coverage, or because of their income, they're not able to afford it themselves. So it's particularly important to the Latino community that there is awareness about these great new options that are available.
First, why is it important to get an insurance with the ACA?
Sure. Well, there's a variety of reasons why it is so important. Some of them relate to healthcare. So we know that people who have health insurance are more likely to be able to have access to health care. They're more likely to have a primary care doctor, to be able to get preventive care, not have to go to the emergency room because they put off care, to be able to afford medication so that they can keep medical conditions under control. So we know that people are health-wise better off if they have health insurance, but also they are financially better off if they have health insurance. We know that the number one cause of bankruptcy in America is medical debt. The number one cause of foreclosures, losing your homes to foreclosure, is medical debt. We know that medical debt can show up on your credit report and prevent you from accessing not only credit, but also employment, housing, life insurance, auto insurance. So in order to have both health security and financial security, health coverage is very important.
Preventing care, I think, is the most important, and is covered with insurance. So let's talk about the Latinos here in Ohio. How many you have reached out to? Do we need, with this information, with this interview, to reach out to the organizations all throughout Ohio, but especially the northern part of Ohio? Tell us about, or ask, the Latino community and Get Covered here in Ohio.
Sure. Well, so we know that there are special needs in the Latino community and special challenges in order to, in the effort to get the word out. So the special needs are that we know that there are health conditions that are not necessarily unique to the Latino community, but that have a serious impact. The incidence of diabetes, for instance, in the Latino community is much higher than in heart disease than the community at large. So it's very important that Hispanics in Ohio have access to health coverage and health care to treat these chronic health conditions that can kill you. And then we know that every year, thousands of Americans die because they have a lack of health coverage. So we want to end that kind of health
And it's
coverage.
not an excuse to postpone those tests and go to the doctor because you will be covered for it.
Exactly, and it's important to know that the coverage that's available through the Affordable Care Act is required to cover preventive health care with no out-of-pocket expenses. So once you have that health coverage, there's no excuse for not going to the doctor. It won't cost you anything out of pocket to go for your annual physical or for checkups to diagnose diabetes or heart conditions or any other conditions that affect the community. So the coverage is good.
But what about my abuela, my grandma, my mama, my familia. So they can be part of this with Medicaid. Explain to us a little bit more about Medicaid.
Sure. Well, it's important to know that there are sort of two pots of coverage that are potentially available. There's private insurance that's available through the health insurance marketplace. Usually you access that through healthcare.gov,
Cuidadodesalud.com.
And
Go.
there were many problems with that website at the beginning, but it's functioning much better now. And so through that process, you find out whether you qualify for financial assistance to help you purchase private insurance so that the premiums can become affordable for every family in Ohio. So that's one track. The other track is Medicaid, which is available for low-income working families. A single person with income below around $16,000 a year can qualify for free medical coverage through the Medicaid program. And you can apply for that either online through benefits.ohio.gov or by going to your county Department of Job and Family Services and submitting an application in person or mailing it into that office.
You have less than $16,000 of your income year.
For a single person.
Single
and so
person.
for like a family of 4, that's more like $40,000 a year. So we encourage people to apply. The Medicaid application is very simple. It doesn't take very much time at all. It's just maybe 15 minutes to apply.
But let's talk about the dates, because it's important that we know that March 15th, March 30th, 31st is an important date for all of us.
Right. So this year, the first year that coverage is available through the health insurance marketplace, began with an open enrollment period, the period where you can apply and enroll in coverage. So that open enrollment period is scheduled to end March 31st. So that means if you become enrolled by March 15th, your coverage will be in effect April 1st. If you enroll by March 31st, your coverage will be in place by May 1st. If you don't enroll in private coverage by March 31st, then you will have to wait until the next open enrollment period at the end of the year.
October, November.
We're looking at probably November 15th as that enrollment period beginning. Now that's for private insurance through the marketplace. We also have to remember that you can apply for Medicaid all through the year. There's no deadlines for applying for that. Right. So in Ohio, the Children's Health Insurance Program is part of the Medicaid program. It's often referred to as the Healthy Start program. And so what's important to know about that is that the income guidelines are even higher than what we've talked about. So most uninsured children will be in families where their income will qualify them for the Medicaid program. Another important issue that may be particularly relevant to the Latino community is if for some reason the parents are not citizens or are not documented, don't have documentation, children born in the United States can still qualify. And there should be no fear about applying for Medicaid coverage. Any information that you provide to Medicaid will not be shared with any other government agencies. Their job is just to get your family all of the medical coverage that you're eligible for. So we encourage anyone with uninsured children should be applying for Medicaid in Ohio because they're more than likely eligible.
Who can apply for this program?
Okay, so again, keeping in mind these two tracks in terms of private insurance, the health insurance marketplace, and financial assistance to help you pay those premiums. All U.S. citizens are eligible. Folks with green cards are eligible. As long as you have legal status in the United States, you are eligible to purchase coverage through the marketplace and to qualify for financial assistance to help you pay the premiums. The Medicaid track, you must either be a citizen or you must have lived here with legal status for at least 5 years in order to qualify for Medicaid. But again, in families where some are either citizens or have documentation and others are born in the United States, those folks who are born here will qualify for Medicaid.
Do you have any statistic or how many Latinos do we need to still to sign up for this? Or how many Latinos in the area already have signed up?
Well, we know this, that 7 out of 10 of uninsured folks have not yet even attempted to enroll in coverage, the new coverage that's available. And we know that that's an even higher proportion in the Latino community. And that may be because of language issues, that they have not been able to get the information they need in Spanish, or they may not realize that that information is available in Spanish. So for instance, if you were to call the toll-free number for healthcare.gov, they can connect you to someone who can speak with you in Spanish. If you need assistance in applying, there are assisters available throughout Ohio who are obligated to be able to provide that service in Spanish if that's your language of choice. So there is information and assistance available in your language.
Let's talk about community-based organizations that we want to send a message.
Right. Well, Enroll America and our Get Covered America campaign, we want to partner with you. You know who is in the community. You know who has the need. You may know who is uninsured. We want to work with you to reach out to those families, provide them the information that they need, connect them to the enrollment assistance that they need. And the card that you're holding is one way that that can be done. These are information cards where we ask uninsured folks for their phone number, their address, and email if they have it. And then we'll follow along with them to make sure that they get the help they need. The top part of the card provides them basic information about the Affordable Care Act. There is financial assistance to help them pay the premiums. They cannot be denied coverage because of a pre-existing condition. The coverage will pay most of the cost for all of the essential healthcare services: doctor visits, medicine, preventive care, maternity care, well child visits, mental health, substance abuse treatment, all of the important services that most people need their healthcare to coverage. Those are covered by the insurance that's available through the health insurance marketplace. Sure. A few ways they can reach us. They can go to getcoveredamerica.org, getcoveredamerica.org. There's lots of great tools there to help people understand the whole process, and so they can submit their contact information there. Or you can call me directly at area code 513-659-0187. That's 513-659-0187, and we'll connect you to the help that you need. A couple more words about Get Covered America. A few of the tools that are available there. If you want to know how much financial assistance you may qualify for, there's a calculator there where you just put in your income, how many are in your family, what zip code you live in. It will tell you how much of a tax credit that you're likely eligible for and what your average premium cost would be. If you need help finding an enrollment assistant, someone who will sit down with you at the laptop and walk you through the enrollment process, there's a tool there where you just put in your zip code and it'll tell you the free, unbiased, certified helpers that are close by to you in your community. So there's lots of information available. We just need to get the word out to folks.
Well, something else that we forgot?
Well, you know, I think the most important place where we share these messages are around the dinner table, when we are meeting with our families on the weekends, when we're talking to our nieces and our nephews, La Familia, as you say. That's the most important way to convey these messages. So be prepared. Ask everyone in your family, do you have health coverage? Ask coworkers, do you have health coverage? You can play an important role in being a champion for them to get the health coverage that they need just by starting to ask that question.
Thank you so much.
Thank you.